that one vape pod can be as much nicotine as a whole pack of cigarettes.
That's true.
This is very true.
Yes. Some cartridges come up with as much as 40 milligrams of nicotine, which is a full pack of cigarettes, basically. So, yeah, it is true.
Welcome to Baptist Health Talk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
Hello, everyone. I'm your host, Johanna Gomez. Welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we're taking a breath and clearing the air, literally. Vapes, cartridges, nicotine pouches, and all the new ways tobacco has gone smokeless have gained popularity in recent years. So before anyone gets hooked by hype, we're uncovering how these habits are shaping a new generation's relationship with breathing, fitness, and addiction. We're joined by Dr. Andres Sosa, general and interventional pulmonologist at Baptist Baptist Hospital. Thank you so much for being here. And it really is a trending topic, not only amongst our community here, but within teens and parents. A lot of people are interested in learning a little bit more. So let's start off with the 101 simple, what is vaping and how does it differ from cigarettes?
Sure. Hi, Joanna. Thank you for having me here. Pleasure to be here. So yes, vaping is different from cigarettes in that there's no combustion involved.
Okay.
We're not burning anything. With cigarettes, there's so many toxins because we're burning tobacco. And when we burn tobacco, all these toxins get released. Mm-hmm. So the thinking is, okay, if there's no combustion involved, we're now just aerosolizing something.
Okay.
We're aerosolizing a cartridge with a liquid in it that has nicotine in it, usually. Okay. So theoretically, since there's no combustion involved, maybe it could be a little bit safer. That's the notion behind vaping.
But isn't it that nicotine on its own is just not good for us? So my theory of the way I look at it is if it's nicotine on a cigarette, nicotine in a vape, pen, e-cigarette, however you want to call it, there's so many of them. Isn't it the same thing, just smokeless?
Yes and no.
In theory, right?
Yes and no.
Okay.
Nicotine is very addictive. Okay. Nicotine is as addictive as cocaine or heroin.
Wow.
Okay. So it is a very addictive drug. And with vaping comes not just nicotine, but other chemicals that are put in put in with it, mm-hmm. so that it becomes more appealing. They put in chemicals to give it some flavoring.
Yes.
There's also chemicals to help it, be aerosolized. Uh-huh. Things like propylene glycol, like glycerol, okay. that have metabolites that carry with them a risk of cancer.
Right.
Okay. So in the long term, we don't know, as we do with cigarettes, because cigarettes have been around for so long. Huh. With vaping, we don't know, in the long term, what the effects may be as well as we do with cigarettes.
Got it.
But yes, it's not just that, okay, it's just another form of getting nicotine. So what's the big deal? It is a big deal because nicotine is super addictive, and it's just not the direct effects from nicotine itself, but everything else that comes with nicotine as well.
Okay, so there are so many different, right? There's like vape pens, there are cartridges, there are mods, pods. I mean, there's just so many. I don't even know the difference between all of them. But how do these all affect your lungs, and is it different the way the impact is?
Yeah. So there may be some subtle differences, but in general, they're all irritant to the entire airway system, starting with the tongue, irritating the tongue, burning on the tongue, the throat. Then you go down into into your actual airways, trachea and bronchi, and all the way down to the small airways. There's irritation, there's inflammation, there's something that's called popcorn lung that we may get to later on. Yes, that's a term
that we will talk about.
That's damage to the very small airways. And then there's damage to the lung tissue itself. There's something that we call EVALI, or e-cigarette and vaping associated lung injury, that put a lot of people in the intensive care unit, a lot of young people in the intensive care unit. All of these different devices can carry on the same type of risk.
And it all affects your lungs. So we all know what the lungs look like, right? What actually happens? You brought it up. Let's talk about that term. Popcorn lungs. When I think about it, I just think of your lungs being crunchy like a popcorn. But then we've also seen the image so much of your lungs being just dark, very dark. Is that what happens when you vape?
Well, so when the term popcorn lung, that comes from a specific pathology that's called bronchiolitis obliterans that was seen in people that were working in microwave factories. So they worked with a chemical called diacetyl, and diacetyl gives a buttery flavoring. So it's just for buttery flavored popcorn. And what this chemical will do when it's aerosolized, when it's inhaled, is that it will cause this reaction in the lungs, this pathology that's called bronchiolitis obliterans. So if you look at the lungs are like, think of a tree, right? Where the trachea is the trunk of the tree. And then that trunk divides in two main branches, which are your right and your left bronchus.
Right.
Your right bronchus goes to your right lung, your left goes to your left lung. As those branches go into each lung, they start branching out into smaller and smaller branches, right? And then finally you get to the leaves. The leaves are the alveoli, or the functional unit of the lung, okay? Just like a tree. So when you get to these very tiny branches, right before you get to the leaf, that's where the inflammation happens in popcorn. In popcorn lung.
Got it.
And it what it does, it just closes up those airways so that no air can go in and out. Oxygen levels start dropping. People can end up in the ICU. People end up needing lung transplants and so forth. And this particular chemical, diacetyl, sometimes can be in the cartridges that are used for flavoring in vaping.
Yeah.
And
it becomes obviously an issue. Let's just play the compare game just to kind of play good cop, bad cop here, see what's worse, what's best. If I have a cigarette and I have a vape, could it be that maybe one is better than the other?
Yeah, so I wouldn't look at it as one being better than the other.
Well, if we line them up, right? Yeah.
There are two. They can hurt in different ways. It can hurt the lungs, the respiratory system, the cardiovascular system in different ways. A cigarette is probably worse than vaping. All evidence seems to suggest that there's a lot more toxins that are released from cigarette smoking than there is from vaping. Vaping may have a role in very, very specific situations for people who absolutely cannot quit cigarettes.
Which is my next question, because wouldn't that make it just an easy transition from going from cigarettes to vaping? It'll maybe kind of make it a little easier to quit that habit.
Yes. So vaping can help people come off cigarettes. It can. But then it also makes them addicted to the vaping. So there's kind of switching one addiction to another
addiction.
Yes. So when we look at people in studies where they've quit cigarette smoking with vaping, a year out, they're still vaping. So that's the issue with using vaping as a way to quit. And that's why it's not recommended to use vaping as a way to quit cigarettes. One should also first try other proven methods that are out there that don't really substitute one addiction with another.
You mentioned how addicting this can be, and it is really. So since it's so addicting and it's really hard to kind of break a bad habit, we know this when you're stuck in a habit. Is there an option for nicotine that's just maybe safer out there for anyone that's kind of stuck in that rut of I've been trying to stop? Because it is really, you fall into a cycle.
Yes, yeah. And there are proven substitutes that we use, like nicotine patches, nicotine gum, nicotine lozenges. And I encourage anybody who's trying to quit they can contact tobaccofreeflorida.com, for example, or they can call 1-877-YOU-CAN-NOW and even get this replacement, nicotine replacement products for free.
Okay.
as well as advice
So
and
would
how
you
to do
say
it.
that the pouches could maybe help a little
The
bit?
pouches,
The patches and there's just so many things
yeah,
out
so
there.
these things have to be supervised. I would encourage people who want to quit smoking to really either talk to their doctor or talk to somebody who is experienced in counseling and helping smoking cessation, and not to try to do them on their own. First, because we do know that most people that try it on their own are not successful.
It's hard.
Usually, it is very difficult. And people that are most successful get some kind of help. Yes, there are some proven nicotine products that we can use to help people stop smoking, but under supervision.
Okay. So I would like you to clear up. There is out there a rumor. So I'm going to call it a rumor because I would like you to debunk it if it's not true. That one vape pod can be as much nicotine as a whole pack of cigarettes.
That's true.
It is very true.
Yes. Some cartridges come up with as much as 40 milligrams of nicotine, which is a full pack of cigarettes, basically. So, yeah, it is true.
And the long term that does for your body, for your lungs, for everything, it's probably years, because just to think of one little cartridge and you think this is probably, and you're hanging out with it all day.
Yeah.
I've seen a lot of that as well.
And there are many things that go along with that. Remember that most people that pick up vaping are young, in the younger years, right? With teenage years, early adulthood, brain still developing. And it's like the perfect time for addiction to kind of set in. All these dopaminergic pathways and are just primed to get this nicotine to, alter in some way that development.
Okay, so I will push back for the sake of somebody right now watching and saying, but it's flavored and it's safe and it's not really nicotine. What do you say to that?
So when it's flavored and there's no nicotine, the cartridge is without nicotine. Okay, so the flavoring can bring with it a lot of other things as well. There are, again, a bunch of chemicals in these cartridges that are not accounted for, that we don't know of, that in the long run can cause some harmful effects that we're not even aware of now. So even without nicotine, it's not it creates that kind of habit of having the vaping, putting the thing in the mouth and inhaling something.
So is it true that this is a real habit just on its own? Just that you want to do this?
100%. 100%. So even if we're doing it even if it's a kid using chocolate cigarettes, well, first it's chocolate cigarettes, and the next thing I'm going to want to do is go for real cigarettes. So
this is an issue that's been happening for some while. Remember those candy cigarettes that they had back in the day? It started from there when you would. So that is a habit.
That's a that absolutely is a factor. Yes.
It is a factor for it.
Yeah.
So we obviously know that the flavors aren't helping also. It's just bad overall. Let's talk about the breathing aspect of it. I have heard that at times it's just really more taking a big breath. Because the thought of smoking or vaping is that you stop for a second to do what? Take that breath and just exhale, but you're actually putting something in. So could it be psychologically, and I'm not sure if you're the perfect person to answer this, but as a pulmonologist throughout your study, have seen that sometimes people just need to just take a moment and just take that big deep breath?
Oh yeah, yes.
Okay.
So and there are people that will tell you that sometimes I just feel like I have to. Inhale,
exhale.
take a sigh.
Yeah.
And, sigh, feel that air coming in. And if you're putting in that, a vape pen or whatever with all those toxins,
it's not going to help.
It's not good.
Yeah.
It's not good.
And then let's talk about the fitness aspect of it, the stamina. the younger you start at this, I believe the worse it is. But what have you seen from patients that you have spoken to that started smoking at a young age or even picked up the habit at an older age and what they're dealing with now?
I have quite a few patients actually that that started vaping and developed airway disease, developed asthma. One of them did not want to give up the vaping, so symptoms kept going on and on and on. When he finally stopped vaping, now he's fine. Just by leaving the vaping alone, his asthma is under control. And maybe he would have never had asthma if it wasn't because he picked up vaping. And just like him, I've had other patients that developed the symptoms of shortness of breath, the wheezing, coughing, and then they stop vaping and the symptoms go away. I mean, all pulmonologists see it.
Right.
Yeah.
Social media has a factor. I could just see from your face, your reaction. All I said was that. It's cool though. It's trendy. You know, you just have to kind of just sit there and just take a puff. How harmful is that? And even with the variety of flavors that they also throw out, how much of that do you warn parents that are watching right now?
Yeah, it's terrible. It's very harmful, especially because it's targeting teens. It's targeting teenagers who don't know better.
Right.
You know, teenagers.
Well, you know, to be fair, smoking was a cool thing in the 80s, right? And in the 90s. And it was pretty much everywhere you went, everyone smoked. People would smoke inside restaurants. People would smoke inside airplanes everywhere you went. Hospitals, exactly.
Yeah.
It was normalized. Whereas now you say, oh, who smokes inside? But now vaping is actually allowed inside. And I think social media had a lot to do with smoking inside, but now we've taken the turn to the inside. What advice do you have for parents?
Yes, and that's a great point, because it's like we're going back to the cigarette years when that was so cool. And that's what's happening now with vaping too. So vaping should be just like cigarettes. In places where cigarettes are not allowed, vaping shouldn't be allowed either. And vaping, it really should not be something targeted for the younger audiences. That's just not right.
Okay, so as a mom, I am curious because I don't know the answer to this. And I'm wondering if there's anyone watching or listening right now, if they're thinking of the same thing. You see a lot of times these kids, younger teens with vapes, e-cigarettes, you don't know what's inside. You don't know if it's nicotine. You don't know if it's THC. You don't know what. Is there a way to tell as a parent?
No.
There's no way to tell how and what they're getting.
And
their
there's
hands
no way
on.
where they got it from either, you know? And we know that when you get it off the street or from a friend or from some other unreliable source, then there could be, and especially when there's THC in it, there can be vitamin E in it, which is what caused the E-Valley, the way we were talking about, the acute lung injury, that can be very severe, and people can end up in the intensive care unit. And there's no way.
So it's pretty much just kind of being on top of your teen and saying like, this is just not good for you. Stay away as much as you can. Do you find that there is support at a higher level with states, government, not to get political about it, but that you feel as a doctor that you would like a little bit more warning labels on these?
Yes. I don't feel like there's a lot of oversight on it. No, I feel like there should be more like there is for cigarettes. If you're
that took a long time for even that to happen.
I think if you're an adult, I mean, you're entitled to do whatever you want as long as you know what the consequences are. If you're a child, it's very different. It's very different, and they should know. People should know that these are not just safe, habits that.
Yeah, that kids should be picking up.
Yeah.
We touched a little bit about the nicotine pouches, but I kind of want to go back to it and just kind of reiterate the impact that we know it does to your body.
Yeah, so nicotine pouches, again, they also come flavored.
They get you with the flavors,
yeah,
right?
they get you with the flavors. And then, of course, you get that sense of a little bit of euphoria, or your heart rate goes up, your blood pressure goes up, your level of alertness goes up. You feel better when, for a brief moment of time before you want to put in another one and then another one and another one.
Do you feel like it gives some people a false sense of security?
Yeah, of course. And then it can lead to gum disease as well. It can lead, to oropharyngeal cancers, head and neck cancer. So, not a healthy habit either. Okay.
You just brought up gums and your teeth, dipping, chewing tobacco, all things also.
Yeah.
What are the effects of those as well? And what do we know now through science and through research?
Yeah, that's what we know. Dipping and chewing tobacco can lead to tongue cancer, oropharyngeal cancer, gum disease.
But does it really affect your lungs?
Well, the lungs directly, not as much as when you smoke it. Okay? Not as much as when you smoke it. But it will affect, it can cause esophageal cancer, oropharyngeal cancer, tongue cancer, and then gum disease. So you have other potential side effects.
Yeah. We started this conversation and we were talking about addiction and how real it is for a lot of people that are going through this. And you stated something very powerful. Nicotine is very addictive. How do you know? Sometimes people cannot tell if they are addicted to something until someone says, here are the red flags that you need to look out for. What should we be looking out for?
Just like with any addiction, just like with alcoholics, right? It's can I spend some time without doing it? Have I tried to stop it for a certain period of time and found myself not being able to do it? Are people around me telling me, hey, I think you may be doing this a little bit too much, and then that actually annoys me, or am I not doing things that I should be doing or that I would like to be doing? Am I not doing those things because I'm doing this? So those are warning signs.
Things to look out for. So if anyone's listening right now and they're thinking of ways that they want to quit, whether it's cigarettes, nicotine, vaping, what advice do you have for them and what should really be their first step?
Well, they should ask for help to try to quit. They should know that it's a habit that can lead to a lot of problems in the future, and that they should do their best to stay away from any nicotine containing product, because they're very addictive. There's no upside to it except from a momentary rush of whatever euphoric good feeling you have. Besides from that, there's no upside to it, and everything is downside. So talk to your doctor if you have a doctor, or talk to a parent, talk to a friend, anybody to help you quit. And again, there are resources like Tobacco-Free Florida and so forth.
What advice? And I asked you this earlier, but this one I'm going to spin it a little bit for parents to tell their kids about why they should not pick up an e-cigarette, a vape pen, or a cigarette at all. Something that could maybe scare them a little bit.
That's a tough one, because kids don't tend to listen to their parents.
They don't. But a good story.
So it would be nice to get an uncle. Maybe, I found for my kids that they listen a lot more to their cousins and uncles and aunts than they do to me. They'll listen to anybody more than to me.
That is true.
So maybe getting somebody like that to talk to your kids and say, look, this is not a healthy habit. This is not. Nicotine is very addictive. It can affect your brain. Your brain is still under development. You can develop behavioral issues later on, attention deficit disorders later on, impulsivity issues later on. So especially during your teenage years, it is very important that you don't touch any of these products. When you are an adult and you're into your late 20s, because up to age 25, your brain's still developing, maybe when you're in your late 20s and so forth, and all the bad side effects that you can get from this, and you're mature enough to make a decision. If you want to make, such a bad decision, go ahead and make it. But right now, please don't do it.
Yeah. You mentioned attention deficit disorder. Has there been any links with nicotine and that as you get older? Because
Yes.
a lot of people are talking about,
Yes.
now I'm ADD.
Yes. As you get older, the brain is under development and so forth. If you addiction to nicotine will definitely predispose to issues like that, impulsivity issues in general.
Okay.
Yeah.
I feel like there's still, as much as cigarettes have been around for such a long time, there's still so much that we're continuously learning about these. We obviously know the fact, right? It's not good for us and it doesn't help us, but there's still so much more to learn, not only about cigarettes, but also about addiction and the real cause. So thank you so much for your time, for this great conversation and sharing all your insight with our audience. And remember, viewers, be sure to hit that subscribe button on our channel right here to keep up with the latest health and wellness information and tips from our experts. Thank you so much for watching, and take a big, deep breath.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.